Good afternoon, everyone, and welcome to this joint webinar, Advanced Care Planning and My Health Record for Carers. My name is Samantha, and I'm the National Manager at Advanced Care Planning Australia, and I'll be facilitating this webinar today. I'd firstly like to begin by acknowledging the traditional owners of country throughout Australia and recognising the continuing connection to lands, waters and communities. We pay our respect to Aboriginal and Torres Strait Islander cultures and to elders past and present. Today's webinar is a collaboration between Advanced Care Planning Australia, Carers Australia and Australian Digital Health Agency. We will feature an expert panel including Advanced Care Planning Australia Volunteer Community Ambassador Jenny Dexter, Carers Australia Director of Programs Jane Bacco-Kilpatrick, and Australian Digital Health Agency Education Manager Kate Ellis. We will be recording today's webinar with the exception of Jenny's story, where there will be a pause in the recording. The recording and slides will be made available to you afterwards. If you have a question for any of our panelists, please enter them into the question and answer box at the bottom of your screen, and we'll be answering those at the conclusion of the presentation. Now, Jenny, over to you to tell us what is advanced care planning and why is it so important?
Okay, so what is advanced care planning? It's important to note that thank you. It's important to note that it is a process, so it takes time, and that it is voluntary. And that it starts with thinking and then with conversations with family, carers, clinical staff about future medical treatment if a person is not able to make or communicate treatment decisions themselves. Thank you. The second important point about advanced care planning is that it helps support a person's loved ones, carers and healthcare providers to know what matters most to that person regarding any treatment so that their values and preferences will be respected. In terms of values and preferences, what does quality of life mean for that person? Is it important for a person to be able to recognise loved ones, to speak, to look after a pet? In terms of medical treatment, what outcomes would be acceptable or unacceptable to that person and in what circumstances? For example, would assisted breathing be acceptable short term, but not if it was needed for the rest of a person's life? And these values, preferences, and acceptable outcomes can differ for each person. Thank you. One important aspect of advanced care planning is for a person to think about identifying and then legally appointing a substitute decision maker. That is someone who can make decisions on a person's behalf if that person loses capacity to communicate these decisions for themselves. Ideally, this process of advanced care planning would then result in a person's values and preferences being documented in a plan, known as an Advanced Care Directive in Victoria, which is a legally binding document if a person has decision-making capacity. If, however, a person no longer has decision-making capacity, an advanced care plan can be completed by a legally appointed decision maker or by family if no substitute decision maker has been appointed. This can then still be used as a guiding document for the person's medical care. Thank you. And the final point on this slide, it's also important to note that the terms and documents used to express preferences and appoint a substitute decision maker are different in each state and territory. The Advanced Care Planning website has relevant information for your particular state or territory, and you can download the documents to create your plan. And this website will be given at the end of the webinar. Just one more point, Advanced Care Planning Australia does have information in a number of languages available on the website. And the telephone interpreter service can be used if calls are made by non-English speakers. The advanced care planning documents do, however, need to be completed in English. Next slide, thank you. So why is advanced care planning important? Thank you. The first point is that for the person receiving care or for a carer, it helps to ensure that the care received is actually the care that is wanted. Thank you. The second point is very important because families and carers of people who have undertaken advanced care planning have less anxiety, stress, depression, and fewer disagreements, and are more reassured and satisfied with the care their loved ones receive. Thank you. Finally, having advanced care planning in place improves ongoing and end-of-life care and can give comfort to family members that they are following their loved ones' wishes.
Thank you, Jenny, for sharing your story. Now we'll hear from Jane from Carers Australia. Jane will start the presentation with a short video.
I wanted to ensure that Jeff had as much dignity as possible at the end of his life and that his wishes were taken care of. He'd had a stroke and gotten sick really fast and he needed somebody to help him out. So that's how I became a carer. I wasn't prepared for how difficult it was to try and advocate for Jeff's needs. He was clear verbally before he got sick about what he wanted, but he never had put anything in writing. Even though I felt extremely privileged being able to be there for Jeff during his end days, and when he died, an advanced care plan would have made it much easier. An advanced care plan empowers the patient and empowers the family so that we can communicate on your behalf about what your wishes are.
What an advanced care plan affords a patient and their loved ones is peace of mind that their wishes are going to be acted upon and acknowledged when it comes time.
To be able to say, I want to die in my own bed, in my own home, with my family and friends around me, or I don't want to die in my own home, I want to die in a hospital. To be able to say that and to have people listen is really important. And people can't listen if they can't have access to what you've said.
Within My Health Record, having an advanced care plan uploaded, the healthcare system and your doctors know what to do. Having a roadmap through uncertainty is so beneficial.
Advanced care planning is for everyone. It's not just for those in a nursing home, those coming to the end of their life. In ICU, many outcomes are not perfect. By having an advanced care plan allows us to have a proper understanding of what the patient's wishes are, supported by their family, for us to provide the best care we can to them.
It's impossible to keep a paper copy of an advanced care plan in the right place all of the time. So the only way that we will be able to adequately listen to people's wishes about their end-of-life care wherever they are in the country is to have digital access to an advanced care plan. This is part of the future, that all of our healthcare information will be linked up and available wherever we are and whenever we need it.
It's confronting and it's a lot to actually go through. An advanced care plan is a way of actually alleviating some of that emotional intensity for your family and for your loved ones.
Thank you, Bronwyn, for persevering with the sound for everybody, and I hope you can all hear me clearly. I'm Jane, I'm at Carers Australia. I have to say it's only day 8 for me, so it's a privilege to be with you all, but also a little bit scary. Having listened to the story of Craig and Jeff and Jenny and John, there were some words that jumped out to me in the video and in the telling. Words like empower, communicate, and having wishes acted upon. And as I reflected on those, they're almost the job description of a carer, in fact, as well, but in this particular circumstance. And as you can see from Craig's story, and the information that's needed by the medical community, the huge number of whom might be involved in a care journey, as Jenny described, having those documents uploaded and available in My Health Record for the person you care for is essential. Not everybody will be as quick on their feet as Jenny was to go and grab the hard copy at that moment in time. And so it then makes that record available when, where, so that your person you're caring for's healthcare team are aware of the wishes of that person. And it will include names and contact details of the people who have access to the advanced care planning documents, which you can then add into the My Health Records. And doctors can contact them should the needs arise. And this is where communication comes in, and the power of being able to ensure the wishes of the person you love are shared and understood. If we could move on, Bron, thank you. So there is some huge numbers of terminologies and definitions, and Jenny touched on some of those earlier as well. But let's just unpack some of those, but start first with carer. So how are we defining carer? So the carer is the person who provides unpaid care and support to a family member, a friend, someone who might have a disability, a mental illness, a chronic condition, a terminal illness, or have alcohol or other drug issues, or who are frail and aged. And because this is a federated system, and it was touched on in the opening remarks, sometimes we find language and terms vary. But this is what we mean by a substitute decision maker. It's someone who's appointed or identified by law to make substitute decisions on behalf of the person whose decision-making abilities is impaired. And they may be appointed by the person, appointed for or on behalf of the person, or identified as the default decision maker within legislation. And they can be listed in advanced care directives, which are statutory, legal appointments, and substitute decision makers listed in advanced care plans are not. So the next slide, please, Bronwyn. So My Health Record. And I reflected on this, and it's always good to talk to the person you care for about becoming the nominated or authorised representative for their My Health Record. And that actually begins the conversation so that you know what their wishes are, and that between you can confirm your role to them as being their carer. We have some of those definitions coming up as well. So an authorised representative, that's the carer with authority to act on behalf of the person they care for. They would have complete access within My Health Record to control those records. They can upload, they can manage the documents, and this can be included in the advanced care plan. A nominated representative in this instance is the record holder. The person you care for chooses the level of access you would have, depending on the amount of support they need to manage the record. They may have access to view or upload advanced care planning information, depending on the level of access that you've agreed. And this can be tricky, but it's important that we all know these definitions and what roles are between everybody. For example, someone's carer may not be a nominated rep, but they might at the same time be a substitute decision maker. But that's nothing to do with the My Health Record. So having those ongoing conversations and covering off on all these issues is important. So keeping an ongoing conversation, as Jenny said, and as Craig described, for advanced care planning generally, but specifically with regards to how we can ensure that the carer's ability to represent the person they love for is so important. So thank you.
Thank you, Jane. Jenny, can you tell us why it is so important to share advanced care planning documents?
Okay, it's already been touched on a few times, I think, but it is very important that these documents can be accessed after you've spent all that time completing them, because they may have to be referred to very quickly when making decisions, as was the case in my situation. And as you've already heard, uploading an advanced care planning document to My Health Record is very important, as it will enable it to be accessed by your healthcare professionals when required. Next point, thank you. But it's also good for it to be accessible to others who, some people may not be familiar with My Health Record, they may not automatically look at it. So it's good for others, family and carers, so everyone will know what you want and respect your treatment choices if you lose the ability to communicate them for yourself. So your substitute decision maker needs a certified copy. It's also good to share it with other family members so they all understand your wishes. Your usual doctor could have a copy, or the clinic you attend. You could give a copy to a hospital if there's one you're more likely to be admitted to, or if admitted to hospital and you have time, you could take a copy with you. If you're living on your own, a neighbour or a person such as a manager of a retirement village could have a copy. Paramedics often look on the fridge for such a document, or look for medications, so you could have a copy with any medications. And finally, it can be a good idea to carry a wallet card when you're out and about, indicating you have an advanced care directive and your substitute decision maker details. And this is something that you can download from the Advanced Care Planning website, print out and then complete. Thank you.
Thanks, Jenny. So now we'll hand over to Kate from the Australian Digital Health Agency. Kate, can you tell us what is My Health Record and how do you upload advanced care planning documents?
Absolutely. So hello, everyone. My name's Kate, and I'm here to talk to you a bit more about the importance of advanced care planning, but also having that information available in your My Health Record. So I guess to start that off, what is My Health Record for those of you on the line who aren't familiar with it? Basically, it's an online summary of a person's key health information. So the My Health Record contains information such as what medicines a person may be on, what medical conditions they have, any immunizations they've had, or any recent discharge summaries from hospital. The great thing about My Health Record is it's personally controlled. So that means that the person actually has control of their record, what information it can contain, which healthcare providers have access to it in terms of privacy and security settings. But importantly, it also means that that person can actually share their My Health Record with a loved one or carer. So as a nominated representative, as was mentioned before by Jane, or as an authorized representative, which means you have that legal authority to act on a person's behalf. So it means that that information in their My Health Record can be accessible to everyone important in that person's care. And very importantly, the advanced care planning document can be uploaded to it as well. It's part of a national system, so every state and territory within Australia has access to it, and it is available 24/7. So I think that's important to note because often people get sick. Doesn't always happen during business hours. It can be in the late night, early mornings when everyone else is closed. Your GP centre is closed, the normal pharmacy is closed, but the My Health Record is still available to access that important information. And it's also protected by privacy and legislation. So do you or the person you care for have a My Health Record? Do you know? Are you aware? So I guess if you're not 100% sure, chances are you and the person that you care for probably already have a My Health Record. The reason I say this is because in February 2019, there was a nationwide My Health Record opt-in or opt-out decision which was made. And essentially at that point in time, for everyone who had a Medicare card in Australia was created a My Health Record for them unless they chose to opt out. And out of the country at that time, it was less than 1 in 10 people chose to opt out of the system. So I guess what I'm saying is more than 90% chance is that you or the person you care for actually already has a My Health Record. In saying that, if you chose to opt out, or if you're not sure, or if you do want to generate a My Health Record for you or the person you care for, you absolutely still can do that. It's just a matter of logging into MyGov and then linking out to My Health Record and creating an account there. It absolutely can be done at any time. So how does My Health Record benefit you or the person you care for? As I've mentioned, as a nominated or authorised representative, so as a carer, you may be able to add health information to the record, such as an advanced care plan. So I guess this means twofold. It either means if the person you care for has already uploaded their advanced care plan themselves, it means that you, as their nominated or authorised representative, actually have access to that document. So you can be that person advocating to help them in a time where this document needs to be known. Or alternatively, you can actually help assist that person by uploading the document for them on their behalf to ensure that that information is available. And I think it's important to highlight this because when this circumstance occurs where the person you care for does go to hospital, and perhaps as Jenny had mentioned, because advanced care directive or advanced care plan can often be a piece of paper, what if they couldn't find the piece of paper? What if they forgot it? They couldn't locate it. No one knew where it was. Maybe no one even knew there was one in existence. Having it on the My Health record means that the emergency department doctors, the specialists, the clinicians, they can actually log into that person's My Health record and view and check to see if there is one there. Likewise, for yourself or as the carer, you can actually log into that person's My Health record on their behalf, and you can access that on either on your laptop or your desktop or even on your phone or mobile device and have it up in front of you. So it is really important to have that digital copy of the record as well as a paper copy, as Jenny had mentioned. And it really just helps to respect those end-of-life preferences for care. So by having that advanced care plan in the My Health record, it means that the person you care for may avoid those unnecessary tests, avoid those unnecessary scans and procedures, which is actually not part of their preferences for end-of-life care. So it's really just respecting the wishes of that person. So in terms of how to upload an advanced care, I'm now going to go through 8 simple steps to upload your advanced care planning document to My Health record. You can see here at the bottom of the screen, there is a link to a video. You'll receive a copy of the slides from this presentation at the end of the session, and that actually has a link to a fantastic video which really steps through the process in detail, and you can use that as a takeaway resource after the session is finished. But right now, I will also go through the steps with you one by one. So step number 1 is to scan that advanced care planning document. As Jenny mentioned, this is often in a paper form. It could be, on your fridge. It could be in your filing cabinet. It could be with your medicines. It could be in a range of different places, and you may only have one copy of it. This is why it's really important to scan the advanced care plan in and make it an electronic or digital format. And when this happens, it means that it can be uploaded to the My Health record system and kept safely and securely in an electronic form, which is available to carers and available to healthcare providers when they need it most. Step number 2 is to, once you've scanned it, to save that document. Now, I will mention it's important to save the document accurately. So what I'd recommend is to include details such as your name, the fact that it's an advanced care plan, and the date for which it was uploaded. So I would name my document Kate Ellis Advanced Care Plan 23rd of March 2023. And this kind of signifies if someone was searching for the document, they could look at that title name and easily understand what that's actually for. Another thing I will mention is often there might be multiple pages or documents that you need to upload. So it might be good to say in the name of the document, document 1 of 2 or page 1 of 2 when you're uploading as well, to make it crystal clear that there's multiple pages or documents available, to make sure that all of the information is at hand when it's needed most. The next step is to sign into MyGov. So essentially, to access your My Health record, or the person you care for's My Health record, you do need to log in through MyGov first. So I've got the link to MyGov at the bottom of the page there. MyGov is a site you may be familiar with already. You access MyGov to access things like Medicare or Centrelink or the Australian Taxation Office, but you also use it to access My Health record. And it is a very safe and secure system and authentication to log in. So the next step is to log into MyGov. After that, on step number 4 is to select your My Health record or the My Health record of the person you're caring for, if you're their authorized representative. And then the step after that is essentially, it'll come to kind of, I guess, the home screen, so you can start to upload that document. So step number 5 is essentially going to the advanced care planning page. So what I'll show you now is a screenshot of what it actually looks like in My Health Record. So up on the screen there, you can see this is the record home page. On the top menu bar, you can see record home, you can see COVID-19 dashboard, and you can also see the documents section. When you click on documents, you can then scroll down to advanced care planning. This is what you want to click on to make sure that you can upload or access those advanced care planning documents. On the next slide, you can see on the bottom of the slide there, I've circled add an advanced care planning document. So when you're going into the person you care for's record, this is where you'll either find the document they've already uploaded, or you can upload it on their behalf depending on your level of access. And above that, you can see there add a custodian details. I'll go through that in a couple more slides time. But the custodian details is what Jenny had mentioned as well, about making sure the important people in your life, your loved ones, your carers, your partners, your children, know that you have an advanced care plan. Talk to them about it. And this is where you can actually list details of those trusted members of your friends or family as a custodian. So then if there's a situation where a person is admitted to hospital, maybe they don't have anyone with them at that point in time, if the medical staff are looking at their My Health record, they can not only gain access to the advanced care planning document, but they can get the custodian details. So that could be a name, it could be a phone number. And that means they can call those important people at that important time in the person's life and get them to the hospital and make those decisions that need to be made. Next slide, thank you. So basically you click on upload advanced care plan, and that will upload the document into the My Health record. Next slide is really just to review and save and make sure it's saved correctly. As I mentioned, save the document as the title, so your name, advanced care plan, the date, and document 1 of 2, or 1 of 3, or however many there are. And just noting that there is no limit to the number of documents you can upload for advanced care plan. So if you do need to upload 2 or 3 or more documents, you absolutely can do so in the My Health record. And then step 8 really is to just add those custodian details and make sure that the trusted family member or friend or carer details are listed there with their name and their contact details, so they can be contacted at that point in time. So on the next slide here, I've basically just shown, I mentioned that there was a video that goes through those steps and details, but we also have an e-learning module which actually steps through advanced care planning information in a lot more detail as well. So if that's something that you would like to work through yourself, you're very welcome to do that, or share that information with anyone who it might be beneficial for. As I mentioned, the link is at the bottom, and you'll absolutely get a copy of the slides at the end of this presentation. So at this point, I'm now going to hand back to Jane to see if we have had any questions from the audience members today. Thank you so much.
Thanks, Kate. In fact, I'll need to ask Bronwyn, as she's acting as host. Has any come through, Bronwyn, whilst we've been listening to Jenny and Kate and whilst I was talking?
None about the content, but more around the availability of the digital copy of the webinar as it's recording. It will be available to be sent out, or it will be available on the Advanced Care Planning website and our website once it's uploaded.
Thanks, Bronwyn. Kate, may I ask you a question that occurred to me as I was listening to you when you were talking about the uploading of a number of documents? And I think probably I know the answer, and it's the importance of the date when you're dating documents, because sometimes people change their minds about what might be in a plan, and knowing which is the current one. Is that what you're suggesting through the use of dates, or is there the ability to actually take down the document that you've already uploaded?
Actually, both really good questions, Jane, and I'm glad you asked me so I could clarify. You're spot on. The reason for me saying it's important to have, your name, what the document is, and the date is in fact for that reason, because wishes can change, preferences can change, and that's absolutely fine. So it is important to notarize what is the date of the document, and in terms of what is the most current date, because that is going to be the one that is going to be acted upon for the person's wishes if there's medical staff or carers involved. And as you mentioned as well, you can absolutely remove outdated copies of your advanced care plan on your My Health record. So similarly to when I showed you how to access that document in terms of how to upload it, that's exactly the place where you would go if you wanted to go in there and remove any prior documents that were no longer current. So you could remove older documents and then re-upload the most current version. That would be my recommendation, to remove old ones and upload new ones. But if you forget to remove the old one, it's okay. As long as you've uploaded the new version with the date, it will clearly be there, and the medical staff will be able to look at all available information and make their informed decision based on that.
That's really helpful, Kate. Personally, I was interested in that as a question. I hope it was helpful to everyone else. And so, yes, are there any other questions? Anybody's got anything they want to add now? Just so we can ensure that we capture off on any thoughts or queries anybody has.
So we have had another question. Somebody has asked, how do medical staff know someone has an advanced care plan in their My Health record?
I can take that one. So essentially, medical staff, when they go into their normal clinical information system, so hospitals, doctors, GP clinics, they have their usual software that they use to access My Health record, so their usual clinical information system. They log into the patient's file and open up the patient's My Health record, and you can actually see the advanced care planning document within that. So essentially, it would be part of the medical practitioner's general, the way they work in terms of checking the My Health record for these kind of situations. But I would recommend, if you are in a hospital situation and you are with a person that you're caring for, to say to the medical staff, and actually highlight the fact we do have an advanced care plan, or we have an advanced care directive. It is on their My Health record. Please make sure you can access that. So it is important to communicate that very clearly, because it may, in a rush, in an emergency situation, they may not have the time to log on or may not realize that it's there. But communicating that means it will give them the prompt that they need to make sure they 100% double check it. I guess they always do try, to find that information when it's needed, but having that prompt and open communication at that point in care, I think, is important.
Thanks. A couple of other questions for you, Kate. Can you include the enduring guardianship document on My Health record?
Yes, you can. So essentially, when you upload a document to My Health record, you select the advanced care planning section, which is the one that I highlighted in the slide. And you can, because it's a PDF upload, you can upload any of those documents that you wish to into that section. So I know that each state and territory have slightly different requirements, slightly different documentation, and that's why it's kind of open in that respect, that you can upload whichever document is most relevant to your state or territory. And on our end, I guess when you're looking at it, or on the medical staff's end, it will look as if it's an advanced care planning document, but then when you open it up, you will see exactly what specific state or territory regulations it was in relation to.
Great. And how can you give someone the authorization to access My Health record documents?
I guess with that question, if it's a healthcare provider, so it's a medical staff, someone at a hospital, by the fact you're having a My Health record, or the person you care for has a My Health record, that doctor, as long as it's part of their point of care, they are able to access the person's My Health record. They don't necessarily need to ask specific permission or consent, because the person may actually be unconscious in some situations or not able to communicate, and then that's why the My Health record is there, to almost help to speak on their behalf if it's up on the system there. If it's for a carer, to access the person's My Health record, you need to become a nominated representative. So that's more of a friend, family member, carer type situation. or an authorised representative is when you actually have full legal guardianship or you're their enduring power of attorney. You need to apply to be the authorised representative. In order to do that, we do have instructions on the slides. There was links on both of those slides, which actually steps you through the process. Nominated representatives is a little bit easier because there's not that legal component to it. And becoming an authorized representative is a bit more of a process because you do need to prove that you say you have legal authority or you are the enduring power of attorney. You just need to basically provide documentation to prove that effect. But yes, it absolutely is possible.
Great. And can you upload an unwitnessed advance care plan document?
Well, you can upload an unwitnessed document into the My Health record because I guess the My Health record system wouldn't be able to necessarily track whether it was witnessed or not. However, I'm probably not the best person to speak to whether the fact that if it's not witnessed, whether it would be taken into due consideration. I may relay that question to someone from Advanced Care Planning Australia who may be able to comment a bit further on the witness situation, whether that does make a big difference.
So we would always recommend that you get your documents signed and witnessed, but we wouldn't see that there would be any issue if somebody didn't have a document signed or witnessed and uploading it, because our understanding is that it wouldn't go through any kind of quality assessment from My Health Records side to check that those indicators have been ticked off. But some people might choose to not have it signed and witnessed, but it does mean that it isn't a legally binding document. It's then just used as more of a guide.
Yeah, that's right. So yeah, the My Health record system would absolutely enable it to be uploaded, but then I guess it's on the medical staff end. Is it legally binding or not? That would then be the next question. But if it could be used as a guide, yes.
So we've also had a question, if someone is alone, so doesn't have anybody to support them, and they don't have the technical skills to upload documents, and they might not have the cognitive ability, what's the fallback recommendation for their wishes to be followed?
So in that circumstance, with respect to the My Health record, where at the moment as I speak, it is the consumer or their carer who has, I guess, the responsibility or enablement to upload that document to the My Health record system. But I can say that this is a question we get asked a lot, and actually we're building that capability for healthcare providers in some settings to be able to upload that document on their behalf. It's not necessarily available just yet, but it will be in the coming weeks and months, where a GP would actually be able to upload that document on behalf of the person. So that's a unique feature that we're trying to build in, because we certainly acknowledge it's not always the person is able to do it themselves, or they may not have that carer to do it on their behalf. So we're building the capability for, say, a GP or even a residential aged care facility in some circumstances to upload that on their behalf, and that is coming soon. In terms of making it accessible, I think that Jenny gave some really good tips earlier about making it obvious in the home. So I know that Jenny mentioned putting a paper copy on the fridge, putting it on the counter, putting it near your medication, putting it somewhere obvious where if a paramedic or an ambulance officer came and visited your home in an emergency, where would they look to find that information? Put it somewhere clear.
We've also had the question, is power of attorney from New South Wales the same as enduring guardianship in Queensland? So from an advanced care planning perspective, what we would refer to here in Victoria as a medical treatment decision maker, so the person that you can identify and nominate to make decisions on your behalf. So it's called something different in every state and territory, which is confusing. But in New South Wales, you would that person is called an enduring guardian, whereas a power of attorney is somebody that might make decisions for your legal or financial situation. The enduring guardian can make those decisions for you for your healthcare. So an enduring guardianship in Queensland is that same person who can make those financial and legal decisions, whereas an enduring power of guardianship in Queensland is the person who can make decisions for your healthcare. So we've also had a question, is the nominated person the same person as who has permission to act on their behalf for aged care program? So I'm not...
So in respect to, so a nominated representative in My Health Record is, I guess, specific to My Health Record. So it is a process in which you are accepted and nominated from that person to have access to the person's My Health Record. I'm not entirely sure if it's a different program you're referring to, whether was it My Aged Care that you're referring to. That would be a separate process, is my understanding.
Kate, by sheer coincidence, my previous role was in aged care, and yes, it would be a set. They may end up being the same person, but it's two different processes.
And I'll just let everybody know we do have on Carers Australia's website a lot of information about authorised representatives and nominated representatives, how to do it, the process, and what they mean. That's also on our website, digital literacy.
We have had the question, who should do advanced care planning? So really anyone and everyone should do advanced care planning, because you never know what's going to happen to you today or in the future. So it's always important to know what it is that you would like to happen to you at end of life, and make sure that you do have, that you are in control of your decisions. So I've also been told that Mariana has her hand up. Ron, are you able to see?
Go ahead, Mariana.
You might have to take yourself on mute, off mute, Mariana. We can't hear you. On the bottom left-hand part of the screen, there's a little microphone. If you click on that, you should be able to hopefully unmute yourself. If not, you may be able to type your question into the question pane and we can help to answer that for you.
I am just sending a request to ask you to unmute, Mariana, if that comes up, so you can ask us your question.
So we have also had a question, have we heard of advanced care plans being left with local hospitals and or local paramedic stations, and the pros and cons of doing this? It's not something that I have had experience with. I've not heard of any instances where that's occurred. However, the more widely shared your advanced care plan or directive, the better. If your hospital does have the ability to collect patient data like that and have those kind of things on your file, then absolutely you can share it with them, but that would really be on a case-by-case basis depending on the hospital that you frequent.
Mariana, were you able to unmute?
We've also had somebody say, assume that old powers of attorney are okay if validly made, as patient has lost decision-making capacity since. So somebody would only need to make the decisions on someone else's behalf, and that would come into effect if they have lost that decision-making capacity.
I suspect if we can't get Mariana unmuted, which is really annoying for her, what we'll do is follow up with you separately so that we can, whichever one of us is the right person, can make sure you get an answer to your question, so that you go away with what you needed from this. Any more questions, Bronwyn, Kate, anyone? Sam? Are we all done?
I just saw there was a question about, is advanced care planning just about end of life care, or does it include other situations as well, like mental health advanced care directives? I know that in terms of speaking to the My Health record specifically, you can upload a mental health advanced directive into the My Health record system, but it will appear as advanced care planning document. So from the healthcare provider's end, it will look like an advanced care planning document, but when they open it up, it can have that mental health advanced directive information in there, and you can absolutely upload it into the same section.
Great. So we will also be sharing a short PDF document with everybody who has registered with some FAQs that we've had. And we will also send through an evaluation survey if you wouldn't mind completing that as well. So thank you to everyone who's joined the webinar today and to all of our panelists. And I'll hand over to Jane.
Thank you so much. It's actually been quite informative for me personally as well. And I do hope that the content that everybody has shared has been helpful to you. But as we wrap up, so on behalf of all the organisations that are represented here and the agency, we wanted to take the time to thank you. As carers, it's actually often quite difficult to find time to do something like this. And so we know you have stepped out of your way to be able to get this information and to hear from us all today, and to recognise that caring looks different for everyone. And we certainly appreciate your contributions. And these are particularly important when you are supporting someone in the conversations about advanced care planning, which are very sensitive for everyone. And as I said earlier, this is around empowering the person you're caring for and you in your role as a carer about the communication and ensuring that the wishes of those that you are caring for are acted upon. And we all hope that what we've been able to present to you today will help you with the helping that you do. Thank you.
So if you would like more information on advanced care planning in general, advanced care planning for carers, or My Health record, you can head to the links on this slide. So as we've mentioned, we will share the slides with you to the email address that you've had, that you registered with. So thank you everyone for attending.
Thanks so much for attending, everyone.
Thank you, everybody.